Gentlemen, imagine waking up tomorrow morning with a level of firmness you haven't experienced in years, without the use of drugs, pumps, or dangerous treatments. Just your own hands and a few minutes of straightforward, targeted stimulation to activate your body's natural erection mechanism. I'm Dr. Sophia Carter, a urologist who has been assisting men in regaining their sexual energy for more than 10 years. And by increasing blood flow, relaxing the appropriate muscles, and enhancing nerve responsiveness, I'm going to demonstrate to you today 3 particular pressure sites on your manhood and surrounding area that can help you regain morning erections. You will know precisely where these areas are, how to properly stimulate them, and how often to do it for actual results by the end of this video. So if you have been missing that automatic morning rise, stick with me. You should know why this works before we discuss the where and how. Once you understand the science, you'll see that you're not just applying pressure to the skin. Rather, you're utilizing one of the male body's most potent mechanisms. Erections are not mechanical or random. But before we go right in, if you're worried about your health, click the subscribe button and turn on notifications, because this is where we share the facts that no one talks about. And if you're with me, please let me know. In the comment field, put 1 if you're currently viewing and this video speaks to you. Type 0 otherwise. You are unaware of the significance of your voice. They are the outcome of a meticulously orchestrated dance between your muscles, blood vessels, nerves, brain, and spinal cord. Nerve impulses, which are tiny electrical instructions that swiftly move from your brain or sensory nerves to the erectile tissue, are the first step in the process. Blood rushes in and fills the spongy chambers known as the corpora cavernosa, when those signals cause the smooth muscles inside the penis to relax. Veins that typically empty blood are constricted when they fill, holding the blood inside and giving it rigidity. This is where becoming older alters the rules. Reduced flexibility in the artery walls over time can cause the blood vessels in your pelvic area to stiffen. This process can be sped up by years of wear and tear, moderate inflammation, or illnesses like high blood pressure. These electrical signals from your brain or sensory receptors don't travel as fast or as strongly as they used to because nerve conduction slows down at the same time. After the ages of 50 or 60, morning erections begin to wane due in large part to this double hit, slow circulation, and diminished nerve signals. The reason targeted pressure point stimulation is effective is that it instantly awakens your neurological system. Clusters of sensory nerve endings are activated when you push or massage particular locations, and these nerve endings then input straight into reflex pathways related to erection control. These signals are not limited to the local area. They proceed to the sacral portion of the spinal cord, which contains the erection center, and even to the pelvic nerve plexus. This sets off a series of events. The neurological system instructs the arteries to widen, the smooth muscle in the penis to relax, and the blood to flow more freely. However, it doesn't end there. The pelvic floor muscles, which resemble hammocks and support the penis during erection and aid in regulating ejaculation, are also directly impacted by some of these locations. Once you have firmness, it will be easier to maintain if you stimulate them to increase their tone and responsiveness. Because of this, pressure point therapy frequently has 2 effects. It can make getting an erection easier and help you maintain it for longer. You can effectively avoid some of the age-related slowdowns and give your erection system a direct, hands-on boost by pressing or massaging the appropriate areas. Consider it similar to restarting a computer, removing latency, resetting the signal, and restoring smooth hardware and software operation. Over time, this kind of stimulation can increase nerve sensitivity, increase vascular flexibility, and retrain your erectile responses. The base groove, which is located precisely where the shaft and pubic region meet at the root of your manhood, is the first location we will focus on. Run your fingertips along the shaft's underside in the direction of your body to locate it. The erectile tissue will integrate into the deeper tissues anchored in the pelvis, creating a tiny depression or groove that resembles a natural hinge. Because it is the meeting place of significant anatomical features, this area may feel significantly stiffer or more textured than the rest of the shaft. Why is this location so important? A rich network of sensory nerve endings, including branches of the penis's dorsal nerve and important blood vessel junctions that supply the erectile chambers, directly are located beneath your skin. Imagine it as a control center where signals from your circulatory and neurological systems come together. By activating this region, you're effectively energizing your vascular system and neuronal pathways simultaneously, promoting improved communication between your brain, spinal cord, and manhood. Two key messages are conveyed to your body when you use light yet intentional circular motions on the base groove. To improve circulation, you first instruct your blood vessels to widen and allow more blood to pass through. Second, you're instructing your nerve fibers to awaken and prepare for more effective signal transmission. Whether arousal signals come in the morning or later in the day, this combination primes the erectile tissue to react more rapidly. Here's the proper way to accomplish things. With your fingers gripping the shaft's back for support, place your thumb exactly over the base groove. Never apply too much pressure at first, just enough to feel the tissue beneath your thumb. Slowly move in tiny circles, allowing the warmth of your touch to permeate the surrounding tissue. You can progressively increase the pressure's hardness as you work, particularly if you sense the tissue starting to relax and soften. It could be a faint tingling, a pleasant warmth, or even the beginning of a feeling of fullness. Your body uses such feelings to alert you to increased blood flow and increased sensitivity of your erectile tissue. Don't worry if you don't feel much at first. The secret is consistency. Daily practice will eventually increase sensitivity in this area and increase the visibility of the outcomes. Work on the base groove every day in the morning, preferably before you even get out of bed, when your body is at its most relaxed, for optimal results. Another ideal time is to take a warm shower, because the heat will have already enhanced blood flow and softened your tissues. This straightforward yet accurate method will help you regain the powerful and inconsistent morning erections you believed you had lost over the course of several weeks. The second point we're concentrating on is in the perineum, a little known and frequently disregarded location rather than on the shaft itself. Between the scrotum and the anus is that soft, slightly bouncy band of tissue. Although many guys completely ignore it, it's a true powerhouse when it comes to erection strength and control. Why? Since it is situated just above the bulbospongiosus muscle, which is essential for preserving stiffness after arousal. One of the primary muscles in your pelvic floor, the bulbospongiosus, is in charge of keeping blood inside your penis during an erection. Consider it a natural clamp that prevents excessive blood loss. If this muscle is not used, it can weaken over time, especially as people age, making it more difficult to sustain powerful erections. This muscle can be reflexively activated by applying specific pressure and massage to the perineal area, thereby working it out without even performing a full set of Kegel exercises. Either lean back with your knees slightly apart or sit in a comfy chair to find it. Press gently but firmly into the middle of the perineum with 2 fingers, preferably your index and middle finger. You're exerting enough force to feel the underlying muscle react, but not enough to be uncomfortable. Keep your fingers centered in that lovely region and move them in slow, purposeful circles. You can feel tiny sensations developing while you massage, such a little pulse as blood flow improves or a soft warmth spreading toward your penis. Your circulation is reacting to your pelvic muscles waking up. Keep your touch steady and under control for 2 to 3 minutes. Before or after the massage, combine this with simple pelvic floor movements, such as Kegels, for an extra boost. Over time, this combination makes your erections seem fuller and more consistent by training the muscle to contract more forcefully during arousal. When it comes to reviving morning vitality, the perineum may be out of sight, but it should never be forgotten. The third and last point is situated directly beneath the penis's head, one of the most delicate areas of the male anatomy. We're focusing on the corona, which is the ring-like ridge where the glans and shaft meet. This is referred to as the glans. There is an exceptionally high concentration of sensory nerve endings in this region. Your body uses these nerves as its primary means of communicating arousal to the erection center in the spinal cord. The proper pressure and rhythmic stimulation of this area can increase nerve reactivity and facilitate the passage from arousal to a full erection. It's comparable to fine-tuning your body's arousal system to make it react more effectively when the moment arrives. Controlling the stimulus is the best way to make this point. Excessive intensity can have the opposite effect by overwhelming the nerves. Using your thumb and forefinger, place them on either side of the corona and gently grasp your manhood to work this area. Pinch the ridge lightly, hold it for 5 seconds or more, and then slowly let go. For about a minute, repeat this hold and release motion, maintaining a firm yet comfortable pressure. Next, move your fingers in slow circular motions around the entire corona, allowing them to glide just enough to activate the nerve ends without irritating them with friction. By further stimulating the sensory pathways, this second minute of circular work promotes quicker signal transmission between the brain and the penis. Stronger, more frequent morning erections may result from regular stimulation of the glandular ring in this mild, rhythmic manner. During closeness, you might also experience an improvement in your general sensitivity, which would make arousal feel more spontaneous and natural. Keep in mind that the goal is to gently recondition the nerves to react as they did when you were younger, not to overwhelm them. Consider it a regular reminder to your body of what healthy nerve coordination and blood flow should feel like. Treating these 3 points as components of a single, deliberate routine, rather than as separate tricks, yields the best results. For best results, I suggest this order to my patients. Start by moving the bass groove in tiny, steady circles for about 90 seconds, or until the area feels warm and sensitive. Then, to engage the pelvic floor and promote deeper circulation, move to the perineal area and push and massage in slow, purposeful circles for 2 minutes. Lastly, use that hold and release technique to finish the glandular ring for 2 more minutes. Then, use mild circular strokes to restore nerve sensitivity. When performed consecutively, this sequence improves neuronal communication, engages muscular support, and increases blood flow, all essential components for more robust and consistent morning erections. I want to set realistic expectations now. There is no magic button here that will change everything in an instant. It takes time for your body to adjust and retrain the muscles, nerves, and blood vessels to function as a unit. Within 2 to 4 weeks, however, many of my patients begin to notice tiny but hopeful changes, such as better morning warmth and fullness, somewhat longer erections, and an overall sense of greater pelvic vitality. Combine this daily pressure point routine with healthy lifestyle choices for long-lasting benefits. Maintaining adequate hydration throughout the day maintains optimal blood volume and circulation. We all grow when we share, so please share what you learned today and what change you're ready to make in the comments box below. Let's support each other. If you found this video useful or if it even slightly opened your eyes, please click the like button. To be sure you don't miss any information that could change your health, click subscribe. Before you go, ring the bell. If this video was helpful, please enter 1. If not, enter 0. You might not be aware of the significance of your comment. The firmness you will perceive from this technique is increased if you maintain a strong pelvic floor through exercises like Kegels. Additionally, don't undervalue the importance of diet. The advantages tend to increase when you incorporate these actions into your everyday routine. Your body starts to recall how it used to function, circulation gets better, and the spots get more receptive. The goal is to provide a safe, drug-free, and entirely controlled environment that facilitates the occurrence of strong, natural erections. You don't have to accept waning or vanishing morning erections as a natural aspect of growing older, gentlemen. Your body is still capable of reacting. All it needs is the proper encouragement and assistance. Without the use of medications or dangerous surgeries, you may retrain your nerves, restore circulation, and regain your morning confidence by tapping these 3 places every day. If this was useful to you, incorporate it into your daily routine and report back to me on your experience. Additionally, any action you do to improve your circulation and muscle tone will benefit you both in and out of the bedroom because your sexual health is a mirror of your general health.